Hello from Liberia. My name is Jutomu Dotin Jr. and I am currently at the Ministry of Health. As you can see, the Ministry of Health is really busy as usual. In 2020, I was the youth advocate who asked the minister about the government's commitment. Today, I am now asking the minister about what progress has been made when it comes to gender equality, especially during this time of COVID-19. Has cross-sectorial collaboration been important in tackling the issue of gender inequality? How has this been important in supporting the health workforce, such as midwives, nurses, and so on during this COVID-19? And this is exactly what the minister said. So as you can recall, last year, which was 2020, we had this conversation with the Minister of Health, Minister Wilhelmina Njala, and we're actually talking about Liberia's commitment towards the PMNCH commitment. Today, Honorable Minister, we are here as a follow-up toward that conversation we had. And it's a pleasure that again, you have, accepted our invitation to talk to the young people and the country at large, informing the entire country about Liberia's commitment and progress we are making. So first of all, I want to ask you, since we last spoke about Liberia's commitment towards the PMNCH, what progress have you managed to make on gender inequality, especially during this time of COVID-19?
For this interview, and we did learn that it was very helpful in terms of reaching out to different partners around the country to be able to support some of Liberia's efforts in terms of gender inequality. Currently, we know that a lot of young people were out of school during the initial phase of the epidemic, and we had a lot of teenage pregnancy, the incidence of rape and molestation and assault. Those rates went up. So the government have taken a lot of steps. The task force around the country have increased, or we have stepped up our one-stop center activities, or the family health division also have set and stepped up the youth-friendly centers. A lot of young people were out of school during the initial phase of the epidemic, and we had a lot of teenage pregnancy, the incidence of rape and molestation and assault. Those rates went up. So the government have taken a lot of steps. The task force around the country have increased, or we have stepped up our one-stop center activities, or the family health division also have set and stepped up the youth-friendly centers, or more of them talking more around safety for young people, or what to do during the time of any type of epidemic, when you are at home or at school and there's anyone that leading you astray. In terms of the mothers, I think the government, especially on agriculture, there have been many small business loans that have been directed towards the female farmers or fishery and things that will help women to be able to support their families during this pandemic, because we know that a lot of the problems have been the ability to be able to support your family, or to sustain or adequate funding for school-age children. So we continue to work on making sure that we have equity amongst both the males and the females during these difficult times.
Thank you, Honorable Minister. And I also want to ask regarding the work in gender equality. How is this work that you're doing towards gender equality, actually supporting the health workforce. And as you know today, there are lots of health workers who are midwives and nurses. And so how is this effort, this work you're doing towards gender equality actually supporting the health workforce?
Well, currently, you know that we have, especially the female, to make sure they are safe, that they too are among those who will be able to get some of those housings as we complete them.
Honorable Minister, I'd like to say thank you for your time. Would you like me come in the future just as a follow-up to all the conversation we are having and to also look at progress Liberia is making towards the PMNCH commitment?
Yes, that would be a great idea. We're constantly in touch with the PMNCH family, and we hope that we can work together to make sure that we are successful in the line of the young people and their issues. Thank you.
It was a pleasure. Thank you so much. So we are currently in West Point. West Point is one of the vulnerable communities in Liberia. And so we begin by talking to community leaders, women, adolescents, and health workers. But first of all, we want to begin by talking to the women of the community. Here we are. Oma, how you doing?
Thank God.
What's your name?
My name is Willis.
Okay. Oma, tell how the community. So can you tell us about your experience during the coronavirus time? What you really experienced as a woman?
Coronavirus, the post coronavirus, that's saying that a bad disease. So we can't tell you one another. And you can't say that by your friend. When you walk in, when you grab you get grabbed. I said, you don't gotta say that when you get grab you, then you grab. See that how you feel. Coronavirus, not good. I'm a trainer. We keep indoor. For to go outside, I might go outside because they say when you grab you anywhere, you drop. You can drop. So I want you to worry me. And God also help us and to conquer all the battles, all the bad things. The thing they put you to say that when you grab you, then you drop on the road, whatsoever, where you grab you fall down. All that one, I thank God, I want it not come my family. But you grab other people that are here, but when you go low, they want all my go around barrel, catch the person. Don't go around there. I say, my people, I will manage go. We don't know where to go. We don't want to do what's going to go. They can you help all. You should be here. They carry some people, they want that from coronavirus. They want they keep the person to the side until you get better. You come back home, you can see them too. But
During that time, your children were in school too?
No,